An innovator in Ghana has rolled out a real-time tracker of confirmed COVID-19 infections across Africa. The app in question was developed to bridge the information gap during the early stages of the pandemic on the continent. CGTN's Nabil Ahmed Rufai takes up the story from Accra.
When Ghana recorded its first case of the coronavirus in March, Darlington Ahiale and his team developed a dashboard to trace its spread across Africa. It was aimed at helping governments make informed decisions on how to fight the virus.
We had thousands of people visit this platform, and beyond just showing the number, we did a lot of analysis to show you that, okay, how does Africa compare to other parts of the world? Then eventually the countries themselves started taking responsibility for this, so they started producing their own dashboard. And the person that is supposed to be responsible for producing this across Africa is either the WHO offices for Africa or CDC, Africa CDC. So eventually they did this.
With the World Health Organization and Africa Centers for Disease Control COVID-19 dashboards in place, his team had to up its game. They are now using the data to predict how the infections could spread in the future as Ghana and other African countries plan to reopen their borders.
Should we decide to open the borders, it shouldn't just be based on past data. You should be able to predict what happens if you do open the borders. And that is what we are trying to work on, our predictive modeling. So anytime you want to take a decision, you run models, you run simulations and see how would it play out if you take this decision. So that will either advise you to either open borders or not to open borders. Or even more specifically, if you do decide to open borders, open them in a very, very specific way.
The team is also developing artificial intelligence solutions to detect abnormalities related to COVID-19 from medical images such as chest x-rays. Darlington says he is now partnering other organizations from across Africa to collect data for real-time analysis of the spread of COVID-19. He hopes the results from this can help governments fight the virus effectively. But a funding gap has stalled the process of work as he mainly relies on grants from external sources and is yet to get financial support from the government. As Africa's COVID-19 infections surpass 1 million, Darlington says more analysis is needed to track the cases in order to know what needs to be done to stop the spread. Nabil Ahmed Rufai, CGTN, Accra, Ghana.